we are here for a conversation with Hugo Tewson, Chairman and Co-founder of Digostics. Hugo, please just tell us a bit about the organisation and your journey.
Sure. Well, it stems from the fact I'm a type 1 diabetic and I got ill over 2.5 years, increasingly ill. And during that period I had all the famous symptoms of diabetes and I wasn't picked up. So my life mission when I was eventually picked up was to find out why. Why was screening not working with a condition that now affects 1 in 9 adults in the world? And half of them are undiagnosed, like me. It's unnecessary because if you could pick people up early, you can manage or reverse or avoid this condition or at least prevent it. So that's where I came from, and I started working with a brilliant biochemist and engineer whose invention this is. So I sit on the side with a lot of commercial experience. So
thinking about AMCs and the kind of ecosystem that they exist in, that you've just alluded to, why are partnerships so critical?
Well, for us, you're a startup, you're always under-resourced, and the most credibility you can get is from the leading AMCs and leading clinicians within those places who have national or even international reputation. And this helped us get funding and critically helped us win big relationships with large pharma who've underpinned a lot of the work we've done, because it's been critical to them. It's been critical to their research programs, to their trials recruitment, and then to programs to help patients. Sometimes we're talking like in type 1 diabetes where we're seen as critical in this new pathway. There's a drug there that costs £180,000 per patient. So you don't want to play with a test that's difficult to provide and very difficult to access and doesn't necessarily promise a lot of accuracy. So that's where we sit.
I mean, partnerships are, in a sense, the order of the day. We've spoken a lot about them, but I guess, and so perhaps it would be easy to assume that it's easy to bring a partner on board. But what are some of the skepticisms, let's say, that you've faced bringing a partner in?
Well, they always say who, because you're a small startup, and often you're from business, not from the clinical world. So there's a bias that you've got to overcome there. We had someone talk earlier about the angels and devils, and of course, people in healthcare are always angels, and to some, people in business are always devils. So you've got that to overcome. You've also got to overcome, where's your clinical evidence? What have you built this on? Who else is supporting you? So you're building layers of credibility with individuals and indeed with institutions. What's quite nice, at some point, institutions tend to follow each other. So because Oxford trialed us, I'm not sure it had anything to do with it, but maybe that's what spurred Cambridge's interest too. It can't hinder you. And the big issue when you're scaling and going international is if you've won major NHS brands, which are also global brands, this helps you to break into big brands in other places in the world. And that's been really of incalculable value to us.
So thinking, just to build on that point about scaling and going international, how important is it to have that international view right from the very start, right from the beginning?
That's a great question. And I think it's a really important question. We were lucky enough to have clinical advisors who worked at a global level. And so we're always looking at and advising us of what was going on in China or Mexico or other places. And from a business sense too, we've had a lot of brilliant investors. So apart from money that we've raised through Big Pharma Co, which has been non-diluting, we've got a number of investors that all aligned to what we do. So they've acted as partners too. Many of them have taken businesses from one, for example, from nothing to $1 billion within 5 years. Many of them have had international experience too. And we've lent on that and benefited from that hugely. Thank you
so much.
Thank you.